You're listening to InTouch with Terri, brought to you by the Inbound Podcasting Network and Terri Ross Consulting, expert management consulting and sales training to help your aesthetic practice thrive.
Now, what have I learned about being an entrepreneur? It means that you're taking a big leap. The big leap is always going to cost twice as much and take twice as long as you think. But if you stick it out and you make it to your first year, you're going to live. If you make it to your second year, you're going to thrive. But you need a plan to do that. You need a plan to make that happen. And this is kind of my plug to the people listening for you, Terri, because that is what you do. You put together a roadmap for people to follow. The roadmap includes the must-haves and then the nice-to-haves. And just knowing the difference between the must-haves and the nice-to-haves is a difference between thriving, success versus failure.
Hello, Terri's Tribe. This is episode 5 of InTouch with Terri, a podcast which is designed for healthcare professionals looking to develop systems and processes to attract more clients, convert more patients into paying procedures, and to generate more revenue. All of this valuable content is provided by Terri Ross from Terri Ross Consulting. My name's Tim Cicerelli with Inbound Digital Media, and back in early February, we had the opportunity to record a couple of podcast episodes at the Medical Spa Show 2020 in Las Vegas. There were a ton of amazing vendors and educational sessions, and one of the speakers from those sessions was Jeff Segal. Jeff's topic in one of those seminars was how to stay out of the crosshairs with online reviews. Now, Jeff Segal is a healthcare entrepreneur, and one of his companies is Medical Justice. They assist healthcare professionals, such as yourself, to protect your practice and your reputation. Jeff took some time to sit down with Terri Ross to talk about how to prevent, deter, and respond to frivolous medical malpractice suits and to take control of your online reputation.
Hello, everybody. Okay, my Terri Tribe. Hi, guys. I'm here with Jeff Segal. Jeff, tell us a little bit about you, and thank you for being here with me.
Well, thanks for having me. So I am a healthcare entrepreneur, but I go back. I'm a neurosurgeon by training and practice for approximately 10 years. I'm also an attorney. I'm a partner at the Bertadotto Law Firm.
So you're a little bit smart?
Well, I have attention deficit disorder. That is my biggest challenge. Still trying to figure out what I want to be when I grow up. And now I run 2 businesses, which would be Medical Justice and eMerit. So what is Medical Justice? Medical Justice works to de-escalate conflicts with patients. Now, you hope that every one of your patients will be great and will never cause you any anxiety. But even if 1 in 500 causes a headache, you want to figure out how that doesn't consume your entire brain. eMerit, the second component of my entrepreneurial world, helps capture feedback from patients at the point of service, gets them uploaded to the gazillion review sites.
So let's talk a lot about that, because obviously we collaborate, right? I think it's amazing. And, oftentimes, there's probably not every client has an issue with reviews. How do I get it? They're doing it, frickin' manually, trying to get a piece of paper, and that never works if the client walks out the door. So, I want to encourage you guys, my clients, my fans out there, anybody that's in this space, wanting to get into the space, has a space, and you struggle with reviews. Jeff, tell us more about that, because I think that's really valuable.
So people are looking for an easy button. What have we learned? We've learned that the traditional way of doing it, asking for reviews, is painful. And why? Because most people shake their head up and down, say, I'd be happy to do it. They go home. They have moved on. Happy people moved on. Unhappy people will find the time to review.
And write some bad
and
shit
write
on
something that's nasty. So you want to do it at the point of service, and we've created an iPad which captures feedback. We call it feedback, not a review.
I love it.
And that makes a lot of difference. Number 2, once they've delivered their commentary on there, it then asks for their authorization to upload to the internet. So it's HIPAA compliant and follows, checks all the boxes for regulatory compliance. And then the patient is asked, do you want to use your name or a pseudonym? And the patient is always in the driver's seat. In doing this, we've been able to capture and upload over 300,000 reviews to the various sites. So that's the positive.
So hold on, Jeff, let me ask you. Now, are there specific questions on that? Well, 2 things. I guess what I think is amazing, because I thought there was always feedback about you can't use the IP address within the practice. So is this a separate IP with the iPad that you have, or tell me more about that?
This then gets Without getting into the secret sauce, the review then gets sent over to other entities to go up. So it's not coming up from the doctor's office.
Awesome.
It's not coming up from the
great.
doctor's office. Some of the reviews are being sent to the patient's phone where they just press a single button and it goes up to the internet using their phone to make it happen. But the big challenge has always been how to get people to participate. We like to say the solution to pollution is dilution. Mm-hmm. So you want a lot of positive reviews. You will get an occasional negative. We help manage the negatives. How do we do that? If the review violates the terms of use for a particular review site, we can work with our account managers, work to get it removed or at least evaluated. Number two, if there's a specific issue with the patient and it's solvable, many times, believe it or not, the patient will either update or remove the review. And then finally, to the extent we can't do any of that, the question is there a HIPAA-compliant response we could send to the world at large to turn a negative into a positive, to send out a marketing message so it doesn't have to sting so much? I'll give you an example.
Yeah.
Patient wrote a nasty review saying Dr. X is a butcher. He ended up causing an infection in my facelift, and now he wants to charge me $10,000 to fix the problem he created. So that's a pretty scathing review. The response was, we're unhappy anytime a patient has an less than positive outcome from our work. We wish all patients had the perfect outcome, but complications do happen. Our infection rate is 1.5% compared to the 3% national average. So in that little description, I've already said that we're better than the national average. Then we say, but patients aren't statistics, and that if it happens to a patient, they don't experience it, as 1.5%. It's either 100% or 0%. Still, we will stand by our patients and we'll do a revision where we waive our professional fee. So we've neutralized the argument that the patient's going to have to pay the $5,000 out of pocket to fix the infection. So in that, we've turned a problem into a potential marketing message that reflects reality, but without ever acknowledging that person is your patient. So it follows HIPAA.
Now, are you both in this plastic surgery space, like all the therapeutic areas? Are you specializing in aesthetic medicine?
We do plastic surgery, aesthetic medicine, neurosurgery, orthopedic surgery, family practice.
Amazing.
You name the specialty, we have clients in that space.
And so how would somebody get in touch with you? How would they sign up? What would the onboarding process be like?
They would come to us at medicaljustice.com. It is that easy. In the time that we've had this conversation, they would have captured their first review and got it uploaded to a review site. It is that easy. It is the easy button.
I love it. Well, again, I think that's such an untapped necessary need in the market. Everybody's, again, wanting reviews, clamoring to go to Yelp, which they have their own crazy, algorithms. So peeps out there, when you guys are looking to get reviews, I would highly, highly encourage you to call Jeff Segal tell us where, again?
At www.medicaljustice.com. That's medicaljustice.com.
Okay, everybody. Thank you, Jeff. Anything else, last words you want to share?
So I started off by saying I'm an entrepreneur, and I think most people listening to this podcast are also entrepreneurs or entrepreneurs in healthcare. Now, what have I learned about being an entrepreneur? It means that you're taking a big leap. The big leap is always going to cost twice as much and take twice as long as you think. But if you stick it out and you make it to your first year, you're going to live. If you make it to your second year, you're going to thrive. But you need a plan to do that. You need a plan to make that happen. And this is kind of my plug to the people listening for you, Terry, because that is what you do. You put together a roadmap for people to follow. The roadmap includes the must-haves and then the nice-to-haves. And just knowing the difference between the must-haves and the nice-to-haves is a difference between thriving, success versus failure. I mean, the last thing anybody wants to see with a client is that they didn't make it beyond their first year. But if you have a roadmap, it's not so daunting. You got to have a bunch of stuff that goes on, and you got to check the boxes in the right time. No, thank you for saying that. And, thank you for what you, contribute to the industry. And I know we're both passionate about what we do. And if anybody's heard me in the past speak or me, I'm just the real deal. And, we teach these 7 fundamentals of the 7-figure practice. We teach the 7 steps of the patient experience. And to Jeff's point, we can't do any of this half-ass, right? If you want to play and thrive, we have to do all of it really well. if you're an entrepreneur, you are all in. There is no half-ass. You are all in. I hear people who say, I want to own a restaurant. Well, okay, if you're going to own a restaurant, you're all in. You're married to that restaurant now, which means the good, the bad, and the ugly. And it's going to be a difficult process. And it's not all wonderful and you just go to your mailbox and collect a check. Similar to any business, in particular healthcare entrepreneurialism, once you start the process, but if you're all in, there's a good, if you're talented, I'm assuming that you're talented, if you're talented, motivated, and driven, and have a good plan with a good strategic advisor, I think the odds are in your favor. Not only are you going to live, you're going to thrive. And who doesn't like working with great people? I love working with talented people. It's a lot of fun.
Me too. I love working with you. Thank you so much. It was so awesome to have you. You guys, medicaljustice.com. Thank you,
Thanks.
Jeff Segal.
See you next round.
Thanks again to Jeff Segal for stopping by Terri Ross's booth at the Medical Spa Show 2020 in Las Vegas to talk a little bit about his company, Medical Justice. Jeff is also a partner at the Bertadotto Law Firm, so we'll include links to his websites in the episode notes. Also in the episode notes, you'll find a link to Terri's online video course. It's called Practice Foundational Elements, Your Roadmap to a 7-Figure Medical Practice. This dynamic online video course offers 5 modules to help you build a rock-solid foundation for your business, and with information that is based off of Terri's 20-plus years of sales experience and her proven methods of scaling a Beverly Hills medical spa, yielding growth of $600,000 in just 1 year. Now, this is the one must-have course that will transform your practice. With this course, you'll learn how to increase your revenue, keep those clients coming back, and learn new techniques to make more money and how to wow your clients, even if you've been in the industry for years. This course will include access to Terri's Tribe. That's a private Facebook group. You'll get workbooks, talk tracks, and key performance indicators, which alone is valued at about $1,500. Plus, you'll also receive the 13 critical components to a successful phone call and special discounts on Terri's additional products, services, and live events. And how about a 30-minute call with Terri Ross herself following your completion of the course? Terri can answer any of your questions directly with you and make sure that you set yourself up for success. Terri will also hook you up with a 30-minute call from her hand-selected industry experts in vital areas to enhance your practice. I am proud to be on her list as a video marketing specialist. My company, Inbound Films, produces high-quality marketing videos for med spas and plastic surgeons all over the country, and I'd love an opportunity to speak with you regarding your website video and your marketing needs. So don't forget to visit the episode notes of this episode and click the link for more information about Terri's course, her Practice Foundational Elements, your roadmap to a 7-figure medical practice. One last thing before we let you go, don't forget to subscribe to In Touch with Terri from whichever podcast platform you're enjoying the show from. That way you won't miss a single episode. For Terri Ross of Terri Ross Consulting, I'm Tim Cicerelli with Inbound Films and the Inbound Podcasting Network.